So there's more research coming out every month about the importance of gut health and autism. But as I've realised, there's no point talking about things like gut bugs, gut inflammation, gut healing diets, gut transplants and so forth, because I can already see some parents zoning out and about to click delete. So let's reverse engineer this maybe, and let's have a different discussion. Instead of talking about gut research and trying to reason with autism parents, or any parent for that matter, to do more gut or diet related stuff with their child, let's look at maybe the signs or symptoms that may indicate your child may have a gut related problem in the first place, especially in the non-verbal children. So this brings me to the study which was published in 2010, so over 9 years ago now, in the official journal of the American Academy of Pediatrics. And it looked at the evaluation, diagnosis and treatment of gut disorders in autism. So let's just look at some of the warning signs mentioned in this article from an expert consensus panel. Signs that we should be looking for in our autistic children, and I've actually thrown in a few of my own as well. So from the family history, things like irritable bowel syndrome, lactose intolerance, food allergy, reflux, inflammatory bowel disease like ulcerative colitis, Crohn's disease, gastritis or stomach ulcers, celiac disease. From the child's medical history, constipation or diarrhea as an infant, persistent colic, projectile vomiting, and like hard to settle after feeding, often described as a very unsettled baby, sleep issues, and current physical signs of poor gastrointestinal health. Chronic constipation, loose stools of diarrhea, alternating constipation and diarrhea, very smelly, malodorous stool, flatulence, straining, reflux, vomiting, and behaviours that may be markers of abdominal pain or discomfort in individuals with autism. Restricted eating habits, so screaming, sobbing for no reason at all, moaning, groaning, facial grimacing, teeth grinding. And some of the less obvious behaviours that are associated with gut-related issues, like agitation, which may be pacing, jumping up and down, unexplained increase in repetitive behaviours, self-injurious behaviours like biting, hit slaps face, head banging, scratching, unexplained increase in self-injury, aggression, the onset of or increase in aggressive behaviour, and constant eating, drinking or swallowing. The application of pressure to their abdomen, leaning on their abdomen against or over furniture, pressing hands into their abdomen or rubbing their abdomen. Sleep disturbances, difficulty getting to sleep, difficulty staying asleep, increased irritability, exaggerated responses to stimulation, non-compliance with demands that typically would elicit an appropriate response, a more oppositional type of behaviour. So disturbed sleep and nighttime waking is seen in 52% of children with autism who have gut-related issues, compared to only 7% of age-matched healthy controls. Now remember that the gut is a digestive factory, and the bacteria in the gut are producing an incredible variety of molecules, and they're both good and bad. But some of these molecules can be inflammatory, toxic, or have an opioid or drug effect on the brain. And if anything goes wrong, there will be pain-related molecules also released. So all these different molecules enter the bloodstream from the gut, and they're able to cross the blood-brain barrier and get into the brain, where they can influence behaviour, cause changes in eating habits, and cause cravings for certain foods as well. Hence we say that often children crave the very foods that they react to or are addicted to, or they simply refuse to eat certain foods as it causes them discomfort or pain. And so the cycle is complete, and this is the autism gut-brain connection that we often talk about. Next, I would actually like to present a case study from my practice, just as an example of how a gut-related issue can affect the child's behaviour. So this is a 2-year-old boy that presented. He had global developmental delay, he was non-verbal, just babbling, chronic inconsolable crying, like the whole consult. He was on his mum's arms, very irritable, crying for the whole hour. he refused to drink any fluids. Now this is very unusual because usually children will refuse to have foods, but this is a child that refused any fluids. And by that I mean, look, no jellies, no icy poles, not even to suck on a wet cloth and so forth. He was a massive mouther. He was grizzly, and he could be grizzly at virtually any time. However, his mum reported that overall he was actually quite healthy. There was teeth grinding, separation anxiety. If he didn't have direct contact or eye contact with his mother, that was it. That had set him off. There was a query over cerebral palsy. He had a CAT scan and an MRI. They were both normal. The family history was unremarkable for any underlying issues that might be contributing. He actually did see a gastroenterologist, and he did actually have a scope through the mouth down, from the top down, and that was considered to be normal. And the next step that they were looking at was medication. So one of the things that we did do was actually, as a diagnostic test, we used some Nurofen or ibuprofen at 10 milligrams per kilogram of body weight. And we did it on 2 separate days, and it seemed to improve his behaviour, which suggested pain. But where was the pain coming from? Look, he's already been assessed by a gastroenterologist and had a gastroscopy, which was normal. So we did a comprehensive digestive stool analysis. So this is looking at the gut bacteria within the bowel, both good and bad, and also the one that I use, Doctor's Data, also includes biochemistry as well. So the stool analysis showed low lactobacilli. This is a good bacteria, and some imbalanced flora like Klebsiella and Staphylococcus, which we can see in infections and so forth. However, the biochemistry was particularly interesting. So when we looked at the digestive enzyme function, his elastase, that was low. So his potential for digestion was actually low. But if we looked at his inflammatory markers, specifically lysosome and lactoferrin, we found that both of those were elevated, which suggests that there was a inflammatory bowel condition going on in his gut. So although the gastroenterologist had done a gastroscopy and scoped the top part of the gut and found nothing, if he'd actually scoped from the bottom up, he would have seen a completely different picture. So we treated this little boy with gut anti-inflammatories rather than the dysbiosis, and the reason being was that he refused any fluid, so we needed to pick the fewest number of supplements that we could actually get into him. And the mother actually reported that as soon as the supplements were stopped, he was much more irritable, had more meltdowns, crying, had more drooling, and so forth. And so it took about over a year to get him back onto track and heal his gut. And I followed him up 2 years later because it was a very interesting case. And at 2-year follow-up, he was actually doing very well. Speech was coming on nicely and trying to talk all day. They were mainstreaming him to mainstream school. Behaviour was very good. He was very compliant. Fluids, he was always drinking now. That wasn't a problem anymore, and he was eating more than his brother. So the possible outcomes for this child was, to spend the money on a stool test to identify the underlying problem and fix the underlying problem, or start on a cycle of medication to treat these so-called behavioural issues, possibly making the underlying issue worse, and possibly being on multiple medications as well. And the mother actually said to me, you are the only one that has actually managed to make a difference. Now, although that is a lovely testimonial, the real credit here goes to the mother. And it's the mother's determination that made all the difference. For a child that was very unhappy and would not drink any fluids, she persisted with trying to get an answer as to why her child was so miserable. Persisted in getting the supplements into her child, putting them into watermelon pieces, injecting strawberries with curcumin, and not getting the supplements in. It wasn't an option for her, and it was a 3-hour journey for the mother to see me with her grizzly child in the back seat initially. So to make it easy for parents, I've actually put together the Autism Gut and Behaviour Checklist. This checklist helps you assess whether your child may have any underlying gut-related issues that may be manifesting as difficult behaviour. Maybe look at this first before medicating a child if they have any behavioural issues. And maybe they are just trying to tell you something, but they can't. It's a comprehensive checklist to simply tick off. The more boxes that you tick off for your child, the more likely that they may have an underlying issue. Remember that gut-brain axis that we talked about. The sooner you address any gut issues for your child, the sooner you will see improvements in your child. So you can download a copy of the Autism Gut and Behaviour Checklist from the link in the description below, or go to my website, allnaturaladvantage.com.au, and download it from there. So with any issue, there are usually a number of possibilities. It's a matter of working through the list to see which one it may be. Just because it's not the very first one on the top of the list doesn't mean you need to give up straight away. It just means you need to look further and find the underlying issue rather than resorting to pharmaceutical medications. Just as in the case study that I just presented. My name is Pietryka. I'm a naturopath, medical scientist and father to an autistic child. Thank you for listening. Remember, you can download a copy of the Autism Gut and Behaviour Checklist from the link below or from my website. Please feel free, as always, to leave your comments below, and please share so we can make a difference to many more children's lives.